Yes, I mean, the lifestyle's interesting because you also mentioned the effect that stress has on inflammation, because it runs both ways, doesn't it? I mean, inflammation can cause an elevation of stress hormones, but if you've got chronically high levels of stress hormone, like cortisol or something, that leads in itself to inflammation, doesn't it?
Absolutely.
And
does
it make your macrophages all boisterous and hooligans again?
Yes, it does. And there have been studies that have shown that even as a seemingly minor stressor like public speaking, so the two of us just sitting here and talking, even those minor stresses are actually tied to a blood level increase of inflammatory markers. But stress in general, the fight or flight response that we developed in ancestral times, we use that in order to either fight the tiger or flee the tiger that we were supposed to deal with. And it's more the chronic stress in our current lifestyles. It's either, maybe chronic stress at work from a bad boss, or bullying, or loneliness, which is a huge stressor for many people around the world, particularly since the pandemic. Loneliness, for example, can actually change the way your immune cells behave. Your immune cells respond to a stressor like loneliness as it would to a germ. In the bone marrow, you see increased production of precursors to immune cells. And so stress overall is something that we do need to address in order to dampen inflammation, and it can proceed very insidiously.
And there's when you talk about things like air pollution and bullying and whatnot, I was thinking about kids, and you have this wonderful phrase right towards the end of the book. You say the immune system remembers, which was a lovely thought, but it was in the context of saying that sometimes if you've been bullied or harassed or neglected as a child, long after, decades after that abuse has gone away, it will still be having a reverberation through your immune system.
Right, and this is just to, we are used to thinking traditionally of the adaptive immune system as having a memory with B cells producing antibodies, and in the context of vaccinations, that's how vaccines work, by training T cells and B cells of the adaptive immune system. But the innate immune system, which involves macrophages and neutrophils, the innate immune system, we are learning more and more about how that arm of the immune system also has a memory. And we see in animal studies, for example, you feed mice a Western diet for a couple of weeks, and even after you stop feeding them that diet, their immune cells are excitable, and they remain excitable for weeks after stopping that diet. And this isn't to say that, we have no recourse when trying to address either these childhood traumas or trying to break dietary patterns into more healthful ones, but that we must be mindful of the fact that your innate immune system does also seem to have a memory, and we need to put practices into place as early as possible and understand the challenges. For example, a kid who's been bullied as a child for a long time may have some additional challenges to face even in adulthood from those prior traumas.
If you don't mind, there's about 4 million questions have come in. So can I start asking something? I'm sorry. Charlotte says, what is the ideal balance or ratio between alkaline and acidic foods?
Well, I typically don't like to think in terms of alkaline and acidic foods because it's been such a buzzword, and I know it's kind of all over online. I like to think more in terms of dietary patterns, and when you are including dietary patterns that are optimal, and when I say pattern, I mean at least, I would say even 90% whole plant foods if you can, or 95 or 100%. So we're trying to push that needle to getting as much fiber as we can. So in terms of dietary patterns, when you eat that way, when you include also the most colorful fruits and vegetables, a diversity of fruits and vegetables and whole grains and legumes, all of that, your acid alkaline balance will take care of itself. So I think it's less about the proportions, the exact portions, and more about the dietary patterns, and also not forgetting about food preparation techniques, spices and herbs, all of these other things that are very important for the immune system.
Okay, anonymous attendee who writes a lot of questions. Will it damage your body to treat inflammation when you don't have it, or will you be healthier? And how can we treat chronic inflammation, please, you said, or she said?
Well, treating inflammation when you don't have it, I would say don't do that, most likely, because you do need some level of inflammation in the body. And then, as I said, also, we are all, in some small way, silently inflamed. And the idea, the notion of silent inflammation, it's a relative concept as opposed to an absolute concept. So if you don't have, if you see your doctor and you don't have any sort of chronic inflammatory disorder, the best thing you could do is just to maximize your lifestyle. So having an appropriate diet and lifestyle.
Anonymous also asks, is inflammation like a fire? If you've got it in one place, like you've got inflamed, I don't know, liver, does it spread all by itself?
It can absolutely spread. And we see this, for example, with, if you have a gum disease like gingivitis and you have inflammation due to poor oral health, that can actually lead to poor heart health, because you can have inflammation in one area that actually becomes body-wide and can be a risk factor for another disorder as well. So it can absolutely be found in specific organs or travel throughout the body and spread.
Okay, Alice asks, how does what you're saying relate to constipation? Is it related to depression?
That's a very interesting question. I can say I haven't been asked that question before. It's very interesting. I certainly think that, with optimizing the gut microbiome, that's one of the most important things. And with eating the appropriate diet, because when you're doing that and you're regulating your bowel movements, you're able to optimize the microbiome with the types of foods that you're eating. And we know that microbes do have an effect on mood. There is a gut-brain connection, and it's bidirectional. So the microbes in your gut and your brain and your nervous system are communicating with each other. And so when you do focus on gut health in that context, and you regulate your bowel movements and you're eating the right foods, you do see that you are able to have beneficial changes in your mood as well. And that's more related to the nervous system as opposed to the immune system, but both play a part.
I assume then that laxatives must be a bit of a disaster, because they just flush everything out, including all of your bio.
Well, some laxatives are very gentle and they don't do too much damage. And then, of course, there are other specific disorders that people are diagnosed with in gastroenterology clinics, reasons that they are constipated, from prior surgeries to changes in GI motility. So we use a variety of drugs in that setting to help them alleviate their constipation.
Okay. Taking supplements and supplements for bacteria, I suppose they're two separate things. One is sort of all those vitamins that you can buy for £500 for a small bottle of something. But then also people are always taking those little bottles of bacteria. Is it worth the money? Do they work? Are there some you should buy and some you should avoid? So
with probiotics, which are bacterial strains that you can introduce into your body in the form of a pill, I think they are really best used in disease as opposed to health at present. So we do have clinical trials on certain disease states for which probiotics are helpful. So things like irritable bowel syndrome, inflammatory bowel disease, antibiotic associated diarrhea, and some others. And I think, probiotics are not as regulated as drugs are. And if you don't need to take that expensive supplement, you don't really need it. It's not necessarily going to harm you if you are otherwise healthy and not immunocompromised. But the key is you probably don't need it. You could just eat some fermented foods. Even a few tablespoons of fermented foods each day would suffice. Okay, well, that's good, because someone's asking, anonymous again, is fermented food good for you? And just for my benefit, what is fermented food? Because I presume that middle-aged men shouldn't just rush out to the pub and say, can I have a pint of fermented beer, please? Absolutely. So fermented food is very healthful. And what fermentation does, fermentation actually refers to respiration without air. So bacteria can transform the glucose in a certain food so for example, you can see yogurt with tons of bacterial strains, and that's a fermented food, or fermented vegetables like kimchi and sauerkraut. And what fermentation does is it introduces bacteria into your body, and it changes the architecture of a food as well. So if you look at a sourdough bread that's been fermented in the ancient tradition versus a bagel that you got at the coffee shop recently, they are two very different foods, even though both are grains and made from wheat. So what fermentation does is increase the vitamins and minerals. It can decrease the anti-nutrients in a food. It can actually decrease gluten. Some fermented foods have lower gluten than the gluten-free foods in supermarkets, which I thought was an interesting fact.
Yeah.
And sometimes patients who have wheat sensitivity do much better with fermented grains than the gluten-free grains even. So
that's interesting. Steve O asks, is there a link between long COVID and inflammation?
There is. I think there is a lot of research going on in this area, and we do know that lingering inflammation is tied to some of the symptoms of long COVID, like brain fog and other issues. So this is an area I think that is kind of just emerging, and folks are learning a lot more about this in general.
Charlotte asks, do we actually get enough vitamins from our food? And I think I'm presuming what Charlotte means is the food that's thrust at us from every side on advertising and at supermarket.
I think that's a good question as well. And, it's important to select the right kinds of foods in the supermarket. So when we think of vegetables and fruits, we don't want to just think of bananas and iceberg lettuce. Not that those are bad foods, those are still good foods, but we want to go for the foods that are similar to our ancestral versions. So when you look at scallions, scallions have even more antioxidant capacity than onions. Kale approaches the antioxidant potential of its ancestral greens. So you want to look for the dark types of fruits, the berries, the dark greens. So you want to choose your foods very wisely, particularly since our nutrient, the quality of our food is also slowly decreasing. We've bred foods to be more palatable in some ways, because we certainly have bred foods to become more palatable. And when you look at, certain fruits and vegetables today and their ancient counterparts, their ancestral counterparts, we might not be even able to stomach some of the Paleolithic fruits and vegetables, but they were chock full of nutrients, vitamins, and minerals. And those little grape tomatoes are very, very dense in nutrients as compared to a regular tomato. And so selecting our foods appropriately is important. And then also, I think I don't see anything wrong with taking a multivitamin, an age-appropriate multivitamin daily is totally fine.
I know what you mean about modern foods. I always think of kale as lettuce that fights back.
That's a good way of putting it.
Heidi asks, I have rheumatoid arthritis. If I followed your plan, could I be cured?
That's a good question. Sometimes I do get those questions as well. And I think, there are so many anti-inflammatory diets out there. I think for the population at large, the plan that I kind of talk about is very helpful and can help to prevent or to treat chronic disorders. For subsets of autoimmune disorders, there are more specific exclusionary diets, and some folks anecdotally have found success with that. So that's something that I think that you should talk to your doctor about as well. But just knowing that for certain folks with certain conditions, thyroid issues, rheumatoid arthritis. In my practice, I also see patients with short guts and most of their intestines missing. There are certain folks who may need some more tailored diets.
Sonia asks, I have celiac disease and thyroid, both of which are autoimmune diseases. Is there anything I can do to reverse either of these, or at least avoid further diseases being triggered?
I think certainly, as I'm sure your doctor has told you, for celiac disease, you want to be 100% compliant with the gluten-free rules, and be very, very mindful of being strict with that, because part of the problem with celiac is that if you're not, you can develop intestinal inflammation that can cause a higher risk of lymphomas and other cancers. Beyond that, I think it would be again, as with the last question, great to tailor a diet specific to your individual condition. And you can try to see if you can work with a medical practitioner to do that.
Harry Conway, for people with IBS, I'm assuming that means irritable bowel syndrome, how can you move to a healthy gut when typical foods such as those high in fiber cause inflammation? That's a very tricky one.
Yeah, so what happens with IBS, we have certain exclusion diets for irritable bowel syndrome, like the low FODMAPs diet, which excludes certain carbohydrates. But typically, these exclusion diets are temporary. They are not a long-term diet. So once your gut improves, once the motility is improved, and once that hypersensitivity is a bit improved and you're feeling more in balance, you are able to include certain foods back again. It does take time when you are changing to any sort of a diet for your gut to adapt. So for example, if you go from a Western diet to 100% plant-based diet overnight, your gut is not going to be happy. It has to alter its secretions and its contractions in order to be able to better process that food. The microbes in your gut are not going to be happy. They're going to be saying, I just got, these burgers every day, and what are you doing feeding me plants now? And these microbes, have to adapt. Human beings have about 20 enzymes to address carbohydrates, but microbes have tens of thousands. So that means in order to build up those microbes that have those enzymes that can process the food you're putting into them, it's going to take some time to adapt. So there's this process of adaptation that will go on.
That's interesting. Emma asks, can inflammation affect my fertility? Is there anything I can do to help it, or eat to help it? And which does link to something I want to bring up, which you talked about, the link between inflammation and menopause. Menopause doesn't get talked about enough.
Yeah, I think certainly the hormonal changes in old age and menopause can play a part in inflammation. You have the fact also that the body fat can move from the periphery to the midsection more often in old age, and the lack of estrogen can help to raise inflammation, because estrogen is a hormone that helps to manage inflammation and helps to prevent the bone breakdown of macrophages of the bone that try to gobble up the bone. And so hormonal changes can certainly affect inflammation. And in terms of fertility, I would say a standard healthy anti-inflammatory diet with all of those nuances as described would be a good thing to do for fertility.
Bryony Allen asks, how is this knowledge of changing the use of antibiotics, which, as they said, can be a sledgehammer to the microbiome? That's a good question.
Antibiotics can absolutely become a sledgehammer, but they are also very important medications. We certainly need to use antibiotics in the situations for which they are indicated, but we also need to be mindful of not overusing them when they are not indicated. And we see a lot of antibiotic misuse around the world. And we need to keep in mind, if you go to your doctor's office, you want to know exactly why you are being prescribed that antibiotic. Are there any alternatives? What the course of the disease is if you don't take the antibiotics. You want to have all of that information from your doctor, rather than just sort of taking an antibiotic for, say, the common cold or something like that for no reason.
Yes, well, there is a tendency for people, doctor friends of mine often say that people don't feel they're being properly treated unless they get an antibiotic. And often my doctor friends say, look, I just want to say to them, look, go home, feel miserable for a day, and you'll be fine. Don't take an antibiotic as well. Yes, agreed. Yes. I apologize to the people whose questions we won't get to, because there really are thousands of questions. So, Magdalena, how about fecal transplants? That's a great question as well. And, it's interesting, because when I started my fellowship, I did the old school fecal transplants, where you actually take a patient brought in a blender with stool in it, and we blended up the stool in the room, and then we infused that stool into the colon. And one person had to walk out of the room. I stayed. I stayed. But fecal transplants are actually great for infections like Clostridium difficile infections in patients who've had recurrent Clostridium difficile infections. Fecal transplants
have proven to be a game changer. And there are pills now, of course, that you can take it. You don't necessarily have to have the stool infused into your colon. And I'm pretty sure we're going to be hearing a lot more about fecal transplants and what they can do in the future for other disorders as well.
Listen, I'm afraid we've run out of time. My apologies to the hundreds of people who've got questions we haven't got to. Maybe we can get you to come back, Shilpa. But in the meantime,
Sure.
From an inflamed nation, thank you very much.
Thank you so much for having me here. It was such a pleasure to speak with you.
Thank you.